Meet the world's oldest Craniopagus twins.
She is very quiet and to herself. She's very, very outgoing.
Living and loving with America's most unusual sisters.
I've had 4 boyfriends. One was really serious.
Falling down laughing.
1 minute standing there fine, and the next I'm on the floor.
Solving the mystery.
I searched for this gene for 10 years.
Of a bizarre sleep sickness.
We discovered it.
A deadly brain condition.
If it burst, I would probably be dead in less than a minute.
And the neurosurgery that's left Jim with an extraordinary disorder.
There was no face on that body to me. It was almost as though I had an aversion to faces.
Face blindness. Animal magic.
I look away for 10 minutes and look back. Now he's twice as big as he was.
Leeches, bugs, and bees helping doctors save lives. The mystery of savant genius.
At age 4.5, he'd memorized the first 8 volumes of the books of knowledge.
He can play 20 instruments by ear, but can't tie his own shoes.
There are no real clues here as to why he can do what he can do.
The most incredible species on the planet is human. Joined at the head. Reba and Laurie Chappelle are medical marvels.
Everybody seeing us might think that there are difficulties in being a conjoined twin, but really there aren't any.
The world's oldest surviving head conjoined twins have overcome a seemingly impossible disability.
We really do have time alone. You know, we're not into each other's faces 24/7.
Which raises the question, if 2 people joined at the head can live such a full and active life, should conjoined twins ever be separated?
No neurosurgeon that I could think of would separate Laurie and Reba.
Reba and Laurie share a high-rise apartment in Reading, Pennsylvania.
Want your morning coffee?
The 43-year-olds are Craniopagus twins, joined by the skull.
I don't want to have it too hot for you, honey. Time to wash the dishes, kid.
That they survive birth is a once-in-2 million chance.
When you rinse it, sometimes it splashes.
Laurie and Reba share bone and vital blood vessels.
Middle. Yep. Put the wide dish down.
And in some curious way, they also share part of their brain.
Yes, I understood you.
They are unique individuals, and yet they share 30% of their brain. They're what's called the frontal lobe and the parietal lobe.
Uh-huh. We are joined at the eyes and at that area up there, all around the whole circle. But we are conjoined by tissue, bones, and blood only. Our brains, we have 2 full functioning. We each have a full functioning brain.
Conjoined twins are a once-in-100,000 occurrence. They develop from a single fertilized egg. Twins normally begin to separate into distinct individuals 13 days after fertilization. With conjoined twins, that separation fails. Perhaps rarest of all are these twins. This is the skeleton of conjoined twins delivered in Philadelphia in 1851. With 4 feet, 2 bodies are attached at the upper trunk, and 2 faces are joined at the skull.
I'm gonna get my cowboy hat.
The Chappelle twins have had to deal with a lot more than being joined at the head. Reba has spina bifida, a birth defect resulting from the abnormal development of the spinal cord. It's left her 4 inches shorter than Laurie.
You can't wear everything every day.
The sisters have very different personalities, too.
Reba is a complete opposite of me. She is very quiet and to herself, and she's not out there. She's more like an introvert.
She loves to shop, she loves to watch TV, and she's very, very outgoing.
Born into a family of 8 children, Laurie and Reba spent the first 24 years of their life in an institution for the mentally disabled. It was a tragic mistake. Neither of them is intellectually impaired.
Because they're both actually pretty intelligent women, they were able to pick up on language, learn to read, and they came to be really friends with the nurses there, and the nurses started treating them as sort of members of their family. And that enabled them ultimately to get out of the institution.
Now, totally independent, Laurie and Reba lead an extraordinary shared existence.
You sure?
Utterly individual, completely attached.
We both love each other very much. But we don't have anything like any telepathies or anything like that. I mean, when she breaks a bone, I don't hurt. You know, I empathize with her, and, you know, it's not that I feel it. You're the best kid.
To be seen as an individual is very important, but to be otherwise with your sister is just as important. But just as long as people realize there are 2 individual bodies here and not just one.
Oh, I don't like that one. Too bumpish.
To be stared at, even taunted, is nothing new for the Chappelle twins.
We do face negative reactions among people out there, but you know, to us, it's not our problem. If they don't like it, they know where the door was that brought them in, they can leave. Because I'm not going to leave.
What's interesting is that they don't face this stigma problem with people who know them well. When they're moving among people who know them, people treat them just as every other person.
$1.88 over here, Mommy.
From time to time, these eccentric sisters role play.
You tell Mommy.
Mother and child.
She calls me Mom because I'm more the mother figure around. I mean, I'm sort of the one who bossy. So I'm the mom, and she's more the kid.
Whatever you say, Mom.
It's not unusual for conjoined twins to exaggerate their sense of independence.
What I've seen from people who are conjoined is a lot like marriages in the sense of they learn to live in a cooperative physical setting, so they have to share the bathroom together, they have to share a bed together. They have to make more of those decisions than other people. But those are really different in degree, not in kind.
After 43 years together, Laurie and Reba can't conceive of being apart. Their emotional and physical bonds are so strong that even given the choice, the twins would prefer to be joined. Some medical ethicists are now saying that conjoined twins should never be separated, unless their lives depended on it.
In some rare cases, conjoined twins are separated because one is dying and it's an attempt to save the other. But that is not the case in most separation surgeries. Most separation surgeries are done for social reasons.
Surgical separation is costly and extremely risky. In 2003, neurosurgeons separated 29-year-old craniopagus twins from Iran in a marathon operation. Both twins died.
If you're going to do a craniopagus separation where people are joined at the head, the skull gets very thick after a few years of life, and the brains can be quite intimately joined and get increasingly joined as time goes on.
Others argue that if the risks are acceptable, conjoined twins should be given a shot at living a normal life.
We now have such experience in the last 20 years that we know that we can clearly improve the quality of life by separating them at the optimal time, which generally is in early infancy.
For Laurie and Reba Chappelle, surgical separation is out of the question. Their brains are too welded together.
I frankly think that either one or both would die as a result of the surgery because their conjoining is so complex and their shared brain tissue is so complex.
We have not considered separation of any kind while we both are full functioning human beings alive. If one should happen to pass, we will then be separated upon the person's death.
The twins have never been able to look directly into each other's eyes. Even watching television, one twin faces the screen, the other faces a mirror. Incongruous as it seems, even conjoined twins can have their own personal space.
I really do have, time alone, because even though she's there, she's not. We're not into each other's faces 24/7.
And the obvious family ties have not stopped Laurie from pursuing a different sort of partner.
I've had 4 boyfriends. One was a really serious relationship that could have gone into a marriage. We were going to be engaged, but we didn't because we were disagreeing on a lot of things, and we weren't going to start an engagement and then yet a marriage, I believe in abstinence until marriage, and which is very rare in these days. But we have, done everything but that, kissing and cuddling and all the making out. I've done that, and it doesn't enter into her because she just, like I said, she can tune everything out. And I've been on dates where she's there only in that one integral part, but she is not there in any other way.
It's not unknown for conjoined twins to marry and produce children. The original Siamese twins, Chang and Eng Bunker, were born in Thailand in 1811. Joined at the abdomen, Chang and Eng ultimately settled in the United States, where they married sisters Adelaide and Sarah Ann Yates. Chang had 10 children. Eng fathered 12.
And they ended up actually maintaining 2 households. Chang and Eng would spend 3 days at one house and then 3 days at the other house in order to be with each family, but also to maintain separate families.
Laurie and Reba are in no hurry to start families of their own. For now, at least, they have their pets. And they'll always have each other.
Boy, no!
Relaxing, and a lot of this is mind over matter stuff, okay?
One of the most complex and dangerous actions a human performs is to swallow. Every day we do it about 600 times. Each swallow uses 26 muscles in the mouth and takes about 20 seconds to complete. Get it wrong just once, and life can end very quickly. From the files of Medical Incredible, the strangest things that have gone down the hatch.
It's time for a nice, light lunch.
Sideshow performer Darren Hunsley has trained his body to pass glass. A single minute shard could perforate any part of his digestive system. Internal bleeding and death would follow for most.
Down it goes.
His trick is to crunch the glass into crumbs, then wash it down with a lot of liquid. The sharp edges will, hopefully, be coated by food and other digestibles in the stomach.
As our food goes through our gastrointestinal tract, there's a constant turning and twisting of everything that goes through. Also, foreign objects are going to be coated or wrapped around the material that's in our GI tract, which in some ways provides a cushion as it goes through.
Nothing beats glass.
In France, Michel Letito didn't stop at glass. He's made a career out of digesting the indigestible. Starting with glass, he graduated to metal, devouring a bicycle chain intact.
The bike went down well, though the chain was a problem and became stuck inside me. Fortunately, a doctor was able to extract it.
Dr. Marzal has examined Letito for over 20 years. Other than discovering a stomach wall that was thicker than most, Marzal has found Letito to be perfectly average.
Here we can see again some pieces of razor blade in the stomach. We can also see screws in the intestine.
A normal man who has trained himself to do extraordinary things. For some, eating the inedible is a compulsive disorder. This hairball was retrieved from the stomach of a 12-year-old girl.
This hairball that she had occupied the entire lumen or inside of her stomach, so that she couldn't eat anymore. She was losing weight and nobody could understand. They thought she had anorexia.
It was a psychological disorder called pica, where people compulsively ingest items like hair or dirt or wax. The hairball had to be removed by surgery. 75,000 times a year, a parent calls emergency because their child has swallowed a foreign object.
About 10 to 20% will require endoscopic removal, and only about 1% require surgery.
This patient swallowed a spoon. You're watching the doctor's own video of the retrieval. The toothpick you see being pulled out here had been embedded in this man for months, and he didn't even know he'd swallowed it.
They identified something sticking up there, and when they cleaned away some food and stuff from it, they identified a toothpick sticking at me.
In the United States, 1,500 people a year die from swallowing foreign objects. But the most astounding cases come from those who survive. A freak fishing accident left teenager Hamish Wilkinson with this lodged in his throat. It's a squid lure with 32 razor-sharp barbs. It flew in when his friend Brandon cast his line.
Well, Hamish, lie down, lie down.
When paramedics arrived on the scene, Hamish was choking to death.
I've never seen anything like it in my 15 years within the ambulance service.
But no one was going to attempt to pull the deadly hooks out.
And it had gone so far already, I couldn't even see the squidgy.
Surgeons cut a hole in Hamish's neck and removed part of his esophagus to extract the lure.
There was a moment when I was going into theatre when my father actually said, I think he actually said goodbye to me.
Today, his scars tell the tale of a miraculous escape. At the radiology department of Wilkes-Barre Hospital, gastroenterologist Dr. David Moore is about to plot the course of a sword going through this man's body. Roderick Russell has trained himself to resist the gag reflex and is now one of the United States' most accomplished sword swallowers.
The gag reflex never, ever goes away. It's being able to swallow a sword does not involve a lack of gag reflex. It involves the ability to suspend the gag reflex.
He's about to find out just how dangerous his chosen profession is. The sword is now passing several key organs.
Oral cavity, cervical esophagus. Now past the esophagus, it's going through the distal esophagus.
It is now less than an inch from his heart.
And the tip of the sword is now in the lower esophagus.
The point has now reached his stomach.
If Roderick were to retch while that sword was down there, that retch alone could bring the stomach right up onto the tip of the sword, or could lacerate the esophagus.
Sword swallowers have played an important part in the development of endoscopes. They were the first to prove it's possible to insert hard objects into the stomach without inflicting damage on the way down. A rare case of medicine learning from the world of the sideshow. What you are about to see is astonishing. This video was shot in the Czech Republic by researchers studying a bizarre disorder. They are trying to make this child laugh. The reason will become clear in a few seconds. The child has suddenly fallen asleep. His laughter has somehow disturbed the part of the brain that controls consciousness and knocked him out cold. These children all suffer cataplexy, a short circuit to slumber. It's a medical contradiction. Too much excitement puts its victims to sleep.
Cataplexy is defined by losing your muscle tone and being floppy suddenly when you're getting excited or happy, most often when you're laughing.
Cataplexy is an extreme symptom of a condition known as narcolepsy, and 300,000 Americans have it.
What we know of narcolepsy is that it's primarily a disorder where sleep is completely disorganized.
Christina suffers from narcolepsy. It's a neurological disorder that can send her to sleep without warning, in an instant.
1 minute, standing there fine, and the next I'm on the floor, I mean, it just looks like I passed out or something.
Little is known about narcolepsy, cataplexy, and a range of other disorders. Most people spend 27 years out of their lives asleep. But sleep is one of the last mysteries in biology today. Scientists don't even know why we need to sleep.
What is a true function of sleep? Why everyone has to sleep 8 hours every night, otherwise you die? Then it's clearly subserving a very important function, but we have no idea what it is.
But we do know these mixed up sleep patterns affect every part of a narcoleptic's life.
School's still pretty terrible. My focus is really bad. I don't retain much information. Studying doesn't work well for me.
Christina's sleep attacks are caused by a naturally occurring muscle relaxant in the brain. It's usually released when we dream. During rapid eye movements, or REM sleep, a person's brain activity goes into overdrive. The body releases a chemical to paralyze us, so we don't physically act out our dreams. Sleepwalking is what happens when that chemical is not doing its job. For reasons we still don't understand, narcoleptics experience REMs while they are awake. The natural paralytic is activated, so they lose muscle control and consciousness.
Is in patients with narcolepsy, they have this very strange tendency to go straight from being awake to REM sleep. And that does produce all kinds of symptoms. For example, they may suddenly fall asleep and start to dream even before they are really sleeping. That produces hallucinations.
Dr. Mignot has been treating Christina in the narcolepsy clinic at Stanford.
You have hallucinations or things that's going on at night?
I do get hallucinations, and those are terrifying. One time, somebody was coming in my room, and I couldn't do anything about it. I couldn't move, and then I woke up.
Christina's condition is suppressed by medication. Dr. Mignot is trying to find a cure, but first he has to decode the part of the brain responsible for narcolepsy.
The cause of narcolepsy, has been a mystery for over 100 years. I mean, we had no clue what was causing it.
He turned to the animal kingdom for clues. Certain fish displayed similar behavior patterns to narcoleptics, but these dogs gave him the answer. When excited, the Dobermans fall asleep, the exact symptoms of cataplexy. Dr. Mignot traced the dog's condition back through several generations. He realized that narcolepsy is genetic.
They're both completely paralyzed by the excitement, you see?
For 10 years, he tried to trace the defective gene.
And in 1999, we discovered it.
Dr. Mignot also found a chemical in the brain called hypocretin. In normal brains, it keeps the person awake. Sufferers of cataplexy don't have that chemical.
It keeps you awake by stimulating your brain cells, and we have to find a way to replace that.
This breakthrough gives hope to sufferers like Christina. With a condition that makes you literally fall down laughing, Christina always has to have her wits about her.
My best friend still thinks it's hilarious to, before I take my pills in the morning, to get me to laugh so that she can watch me fall down, and she has power over me.
In medieval times, healers used leeches to treat their patients. Medicine has come a long way in 500 years. Or has it? In the 21st century, sometimes animals are just what the doctor ordered. In San Francisco, Scott Thornton lost 4 fingers in a worksite accident.
He started moving and the front wheel caught the tail of the tagline. The wheel acted like a winch and just cinched the rope up and everything was just whoop. And I glanced up and I saw my hand and all my fingers were gone. What was there was tattered flesh and meat and bone.
3 of the fingers were unsalvageable. The 4th was sewn back by microsurgeon Dr. Charles Lee, tendon by tendon, nerve by nerve. There was no guarantee the blood would resume flowing freely through the reattached digit. If it clotted, the operation would fail. So Dr. Lee had an idea that took Scott completely by surprise. He wanted to attach blood-sucking leeches to the wound.
I'd be sitting there, my arms propped up in a splint and bandaged up, and this slimy critter on the end of my finger. And I look away for 10 minutes and look back. Now he's twice as big as he was, and like 40 minutes later, he's huge.
The idea is that the anticoagulant in the leech's saliva would stop the blood from clotting across the joint. It worked. Better than that, Dr. Lee replaced Scott's other missing digits by harvesting his toes.
I said to him, well, Scott, we can actually take your toes and place them on your hand.
I remember clearly what I said, you can do that? You know?
The new fingers worked so well, Scott has begun a new career as a draftsman.
You'd be surprised. I can write very well with my right hand. I don't have the endurance. My hand gets tired and sore quickly.
If leeches turn your stomach, put yourself in Donna Nordquist's shoes for a minute.
Well, hello, Donna. How are you doing today?
I'm doing fine, doctor, but
This doctor is about to treat her badly cut ankle with live maggots.
Maggot therapy is revolutionizing the care of patients with very difficult wounds and making their lives a lot better.
The treatment is brutally simple. Maggots, or fly larvae, eat decaying meat. Donna's cut is not responding after 6 weeks on conventional drugs. The maggots will eat the infected flesh, cleaning the wound.
It takes a special patient to be willing to try this. We know that the maggots will engulf infection, they'll eat it up, they fight infection, and they stimulate the wound to heal.
These maggots have been specially chosen for their ravenous appetite for dead flesh.
What modern medicine can take months to accomplish can often be treated in a couple of weeks with maggot therapy. Okay, Donna, you did great. We're all done. And we'll see you
in a couple of weeks and a few more maggoty sessions, Donna's ankle will heal.
Tremendous
Thank you, doctor.
In Egypt, patients are allowing themselves to be stung by bees. Lots of them. In ancient times, bee stings were used to treat rheumatism and colitis. Today, doctors are still employing the bee to help carriers of hepatitis B, a virus that attacks the liver. Dr. Hassan Shabi will sting his patient between 3 and 25 times per session. It's not a cure for hepatitis, but it relieves the symptoms for long periods. One theory is that the sting stimulates the patient's immune response. Another theory is that the attack itself prompts the patient to induce its own supply of endogenous interferon to fight the viral infection. According to Dr. Shabi, it's 100% effective. Pain today, gone tomorrow. Dogs are known to have advanced senses of smell. Doctors are now discovering just how advanced they really are. Could it be that canines can actually smell cancer?
A dog's ability to see scent would be like our ability to see colour, really. It's a completely different world.
In England, Gil Lacey's dog started acting strangely when it was near her.
Is it Sam? One day when she was walking past me, she suddenly came towards me and sniffed at a mole on my leg. And every time she came past me, she would sniff suspiciously at this mole and lick at it and nibble at it.
The mole turned out to be a malignant melanoma. It was removed by surgery. Her dog's early signals may have saved Gil's life.
It was caught in a very, very early stage. So luckily for me, they were able to take it all away, so that it would be okay.
Medical researchers are now working with dog trainers to see if canines can consistently detect the presence of cancer in humans. The earlier cancer is detected, the better the prospects for survival.
Hello, you.
This cancer hound is about to be put to the test. A urine sample has been taken from a patient with bladder cancer. Other urine samples without cancer are also laid out. The dog is supposed to lay down next to the sample containing cancer compounds. In just seconds, the dog finds the one sample with cancer.
If our dogs can be recognizing cancer or cancers at an early stage, that at the very least would complement what modern health services are already, of course, offering.
Clever girl.
Humans have about 5 million receptor cells for scent. Dogs have 50 times that many. Dr. Church is hoping that, with the help of dogs, early detection of cancer will mean early intervention and lives saved.
So there are a number of different ways where dogs are helping human beings with medical conditions. Quite where it will lead, I mean, that's the excitement of it all, really, that we're pushing back boundaries of knowledge, and where we'll be in 20 years' time, we really can't say.
Imagine a world in which faces no longer exist.
There was absolutely no face at all.
A lonely existence where even family members are alien.
I don't really want to understand it. I want them just to be able to see me.
And where friends become foreigners.
They feel like when they go out into public, they're often snubbing people that they're friends with.
This is the bizarre face of Prosopagnosia, where even reflections reveal strangers.
Well, looking in the mirror, really, I see my shirt, my glasses, my mustache, and with looking, I see my hair. And there is a face, but I don't know, I don't recognize it. I know it has to be me because this is a mirror and I'm standing here, but I don't recognize me as being me.
In 1992, Jim Cook lived a very normal life. A simple symptom was about to change his world as he knew it. Jim's face went numb. An emergency brain scan revealed a mass of blood vessels in his head ready to burst.
I had something called an arteriovenous malformation, which is a mass of blood vessels that didn't form right during the second or third week of fetal formation. If it burst, I would suddenly feel excruciating pain in my head, start bleeding from the eyes, ears, nose, and mouth, and I would probably be dead in less than a minute.
Emergency brain surgery followed. The threat to Jim's life was fixed. He was relieved, but unaware that his world was about to be shattered. Shortly after his operation, Jim was watching his favorite police show when he noticed something very peculiar. Jim realized all the faces looked blurred, not just the criminals.
Like I would see a person, their entire body, the torso, the legs, the arms. There was no face on that body to me. It was almost as though I had an aversion to faces.
And it wasn't just the TV image. Jim had literally become face blind.
They see perfectly well, and yet that information isn't processed normally by the brain, and so then they have a lot of difficulty with face recognition.
Harvard University's Dr. Brad Duchesne is plumbing the mysteries of a condition known as prosopagnosia.
Okay, Glenn, so I'm going to run you on a test of face recognition memory.
It's a bit like having bad TV reception. The eyes receive the right signal, but it's not getting to the part of the brain responsible for recognition. From their perspective, they can't see faces. Glenn also has prosopagnosia. His face blindness came from an accidental blow to the head when he was a baby.
Okay, and you just need to pick out which one of those 3 faces is one of those 6 guys.
Dr. Duchesne has deliberately removed any non-facial recognition cues, like hair.
You can recognize any of those?
No, not really.
Without them, Glenn is lost. Glenn and Jim live in a world full of faceless encounters.
A friend of my son's came to the front door, knocked on the door. I went to the door and I looked out, and I heard a voice said,
"Hello, Mr. Cook."
And I looked, all I could see was hair, the gold frame of glasses, and a red sweater. There was absolutely no face at all.
Jim's condition means he can't trust his eyes. Sometimes prosopagnosia isn't confined to face blindness. Jim can see an empty street, even when there are cars approaching. Crossing the road is risky business.
You see us there?
Yeah, now I see you.
Jim's prosopagnosia is so severe, he hasn't even been able to recognize his own kids since the operation.
It was hard to understand. Being 12 years old, you can't grasp the concept of your father not being able to recognize your face.
You know, like, what do you mean you can't see me? You know? I mean, so in reality, he really hasn't seen what I really look like in 10 years. You know, I've changed a lot since then, you know, and it's difficult to understand, and, you know, I don't really want to understand it, you know, I want him just to be able to see me, you know what I mean? Whiteface wasn't it? Keto Law? That's a good first one.
What you're about to see happens every time Jim Cook catches up with these regular backyard visitors.
Quite often I'll come out of the house because I want to ask either Tommy or Cindy a question.
This is for real. Jim knows everyone here, his kids, his nephew, and their friends.
I won't know which one is Tommy or which one is Cindy amongst their friends.
So how does Jim identify people in these situations?
I mean, I'll see he's confused, or he's not sure where I am, or maybe he is looking for me. And I just gotta stick it out there, basically.
Yo, Tom?
What's up, Dad?
Jim's brain can put at least some names to faces, but it's strictly non-face cues, like the sound of Tommy's voice.
Come over the ridge, Mogul Field.
Or a person's distinctive clothing.
I use location, size, gender, hairstyle, voice recognition, things like that to figure out who someone is.
But what if that same group of people changed those non-facial cues? With Jim back in the house, we asked them to swap clothing to see what happened.
Cheers.
Cheers, yes.
Salute.
It's only been 2 minutes since he was last out here, but now Jim can't recognize anyone.
Tom?
It's not until he hears Tom's voice
Tom?
What's up?
You expecting more people over?
that he knows which one of these strangers is his son. The only upside to prosopagnosia. The way Jim sees it, you're always meeting new people.
It's sort of interesting seeing the same old person as a new person every time you see them.
Even if it's your own flesh and blood.
Who are you?
I'm your nephew.
Oh, okay. Okay, be like that. Okay.
See you, Mr. Cook. I don't know, whatever he's cooking.
Sometimes the brain tells the body lies. Brain betrayals are hard to diagnose and even harder for others to understand. And they are some of the most bizarre cases in medicine. Mary Rose has one of the most mystifying conditions in the world. she can actually see sound.
That makes sense.
When people talk, their words to Mary Rose come out like a rainbow.
Every letter of the alphabet has a distinct color. A is red, B is blue, C is yellow, and then D starts to get this sort of strange yellow-orange color, and so on through the alphabet.
The condition is called synesthesia, a confusion of the senses. They can smell music, hear silence, or see sounds. Mary Rose thought she was hallucinating when she saw underwear coming out of someone who was laughing.
I was riding in a car late at night. A friend of mine was sitting in the back seat and started laughing. And all of a sudden, these starched white pinafores came over the shoulder, here. And the more she laughed, the more these pinafores came out. And they just kept floating forward. It's one of the few times I've ever seen things out, not in my mind, that I actually saw it in the car.
Strange, but not that uncommon. 1 in 2,000 people have some form of synesthesia. When one sense, like hearing, is activated by sound, it triggers a second response in a different part of the brain.
One lady told me about every time a dog barks, there's a particular dog in her street, and every time that particular dog barks, it's a very jagged red that she sees when she walks past.
It's a bit like getting a crossed line on a phone call. The twist is, there is no cure because synesthetes are not actually sick.
Synesthesia is not a disorder. It generally doesn't interfere in people's lives in any way, and if anything, it's an unusual gift.
Jim Cook may be one of the few people in the world with 2 different brain betrayal disorders. A brain operation left him blind to human faces. And his left hand has literally developed a mind of its own.
I grabbed the door with my right hand, I swung it closed. Before it got all the way closed, my left hand just went up, stopped the door, pushed it back open.
Jim has a classic case of alien hand syndrome. The brain no longer coordinates the movement of the hand, resulting in seemingly random, out-of-control actions. One victim nearly killed himself while driving a car because one hand could barely stop the other from steering off the road. Would it have been suicide or self-murder? A legal paradox thrown up by a medical aberration. Tiffany has an even more bizarre neurological condition. After suffering a stroke, Tiffany lost her ability to speak. This is how she sounded before the collapse.
They've been traveling from Fort Myers to Orlando to Tampa to...
But once her speech returned, suddenly Tiffany, from Indiana, seemed to have an English accent.
They looked at me like I was crazy, like I had lost my marbles or something.
She was astonished, and so were her friends.
When I heard her speak with the new voice, I didn't recognize her.
Even Tiffany's neurologist was perplexed.
He says, why are you faking that Brit dialect? He knew me from before. And I said, I'm not faking any dialect. Well, why are you speaking that way? I said, well, you're the doctor. Why am I speaking this way?
What no one realized at the time was that Tiffany was suffering from a rare affliction called foreign accent syndrome.
Foreign accent syndrome is a perceived foreign accent, not due to the person speaking a foreign language or having a foreign family. That is a result of a neurological insult. In America, we say...
Tiffany hadn't magically acquired an English accent overnight, but the stroke had damaged the left hemisphere of her brain in an area that controls language.
In America, we say she's putting on a party dress. What do they say in English?
I say she's putting on a pretty frock.
In relearning to speak, Tiffany had lost her language reference points, like a computer with a wiped disk. So as she regained her speech, her voice distorted into something that resembled a foreign accent.
I say that I left my automobile in the garage. Will I get it back? I don't know. Stay tuned. We'll find out.
The brain can play many tricks on the mind, and syndromes that distort perception are some of the most incredible conditions in medicine. don't be fooled by this man's strange manner.
Furthest south.
Or the fact that he can't brush his own teeth.
Furthest.
Kim Peek has read more than 7,000 books and remembers every fact.
Henry Harrison, Tyler Polk, Taylor Fillmore, Pierce Buchanan, Lincoln, Andrew Johnson, Grant.
We've done a total of 30 shows on the road, actually.
And don't be misled by this man's autistic rocking back and forth. Tony Dubois is blind. He can't tie his shoelaces. But he can play 20 instruments and has a repertoire of 8,000 songs committed to memory. These might be severely damaged brains, but they can accomplish mental feats that leave the rest of us gasping. They have savant syndrome.
Savant syndrome is an exceedingly rare condition, and these are people whose skill would be spectacular even if it were to be seen in a normal person. And those are very rare, probably less than 50 such individuals living worldwide at the present time.
Kentucky.
Prodigious savants often have an innate sense of how calendars work. Kim can name the day of the week for any date in any year.
At age 4.5, he'd memorized the first 8 volumes of the books of knowledge, which were the index volumes.
Kim lasted only 10 minutes in school. He was thrown out for being too disruptive. His father, Fran, has been looking after him ever since.
I knew he'd been reading telephone directories because I helped get 6,600 telephone directories from our local telephone company.
Savants often have astonishing mathematical abilities. And like Tony Dubois, they usually have phenomenal memories. Kim Peek's talents cover music, mathematics, and the retaining of vast amounts of information from history and literature. And that puts him in a category all his own.
You'll have Fran use this term mega-savant. That's not a term that anyone else uses. That's Fran's term. But it kind of says something. I mean, he's beyond even most of the savants.
But why a damaged mind like Kim Peek's can do what it does is a puzzle.
There are no real clues here as to why he can do what he can do.
Kim was born with a head 1/3 larger than average, but his brain has just one hemisphere. And there are fluid-filled gaps where you would expect gray matter to be.
You would look at this brain and expect deficiencies. So to see these added skills and abilities and talents that Kim has, it's a mystery.
And what causes savant syndrome remains an even bigger mystery. But there are clues. Savants are 6 times more likely to be male than female. And typically, savants demonstrate left brain damage. It may be that as their brain develops in utero, some males produce too much testosterone. In high concentrations, the hormone is toxic to fragile brain tissue. And since the left brain is last to develop, it's the hemisphere that's damaged more, and mostly in males.
In some persons, then, this more vulnerable left hemisphere is affected by the testosterone, and it has its neurotoxic effect. That same incidence is what you will find in autism, hyperactivity, stuttering, and a number of other conditions.
Savant syndrome is one of neuroscience's most puzzling conditions. It produces some of the planet's most remarkable brain power and some of the most gifted individuals you'll ever see. That all this is the product of a severely damaged mind remains firmly in the realm of the medical incredible.